Did you know that some babies are born with their stomach or liver in their chest? This happens because of a rare condition called congenital diaphragmatic hernia or CDH. Before birth, a baby's diaphragm, a thin muscle that separates the chest and abdomen, might not form completely, thus leaving a hole. This allows organs to move into the chest, crowding the lungs and the heart. CDH is a rare condition, affecting about 2 in 10,000 births worldwide. But thanks to modern medicine, many babies with CDH can grow up healthy and strong. Now, to better understand this condition, our group will report on this embryonic anomaly, exploring how it develops and the challenges it can pose for newborns. First, let's get to know more about the diaphragm. This dome-shaped muscle under your lungs works automatically, pulling in air as you breathe and pushing it out as it relaxes. But it does more than that. It aids in digestion, supports urination and defecation, and even prevents acid reflux. With key openings for the esophagus, blood vessels, and nerves, the diaphragm keeps your body running smoothly. Now, ever wonder how this incredible muscle came to be? The diaphragm starts forming early in pregnancy, around weeks 4 to 5, from three structures working together. First, the septum transversum acts like a foundation, separating the chest and the abdomen. Then, tiny pyramid-shaped pleuroperitoneal folds grow from the sides of the esophagus, moving in to connect with the septum and to form a strong central tendon. And finally, muscle cells from the neck area, the C3 to C5 somites, travel down to complete the diaphragm, linking it to the phrenic nerve for its vital role in breathing.
However, congenital diaphragmatic hernia happens when something goes wrong during the development of the diaphragm. This could be because the pleuroperitoneal canal or the septum transversum did not close properly between weeks 9 to 10 of pregnancy, leaving a hole in the diaphragm. Another cause is disrupted diaphragm development due to genetic mutations, like in the GATA4 and FOG2 genes, which play a key role in shaping the diaphragm and other organs. There are two main types of CDH: Bokdalek hernia, which usually occurs on the left side because that side of the pleuroperitoneal cavity closes later, and Morgagni hernia, where the diaphragm doesn't close properly at the front, often on the right side near the sternum. These issues can lead to a hole in the diaphragm, allowing organs to shift into the chest and cause problems with breathing and other organs.
Imagine if your lungs couldn't fully grow because your stomach or your liver is in the way. This is what happens with babies with congenital diaphragmatic hernia or CDH. So, normally the diaphragm acts as a barrier between the chest and the abdomen, but in CDH, there's a hole, and the abdominal organs move up into the chest. So, this causes a huge problem for the lungs. They don't really have enough space to develop properly, leading to what's called pulmonary hypoplasia or underdeveloped lungs. So, babies with this condition often struggle to breathe right after birth and may need special machinery like ventilators or ECMO to help them get enough oxygen. The heart also feels the impact. With the lungs underdeveloped, the blood vessels in the lungs don't work well, causing high blood pressure. This makes the heart work extra to ensure that enough blood is being pumped into the heart, sometimes leading to blood failure, circulating throughout the body. Even the digestive system doesn't escape unharmed. Organs like the stomach and the intestines may be pushed into the chest, making it hard for babies to eat and digest food properly. They may need special care, including surgeries, to fix these problems and to make sure that they can grow and thrive in the future.
CDH is often spotted before birth during routine ultrasounds. Doctor can see organs like the stomach or liver in the baby's chest instead of the abdomen. To get a clearer picture, they might use advanced tools like fetal MRI or echocardiograms. These help check the baby's lungs and heart for any issues. After birth, doctors confirm the diagnosis with chest x rays and maybe do tests to measure oxygen levels or look for other genetic conditions. The measure outlook for babies with CDH depends on the size of the diaphragm's hole and how well the lungs and heart are working. Thanks to better surgeries and treatments, survival rates have improved a lot, now about 70 to 80% globally. However, some babies may have challenges faced like breathing issues, or developmental delays as they grow. Moving on, treatment for CDH starts before birth for severe cases. A special procedure called feto or fetoscopic tracheal occlusion can help the baby's lungs grow by temporarily placing a balloon in their airway while still in the womb. After birth, these babies need specialized care in the NICU or neonatal intensive care unit. Breathing support like ventilators or ECMO, that stands for extracorporeal membrane oxygenation, helps their undeveloped lungs function. Once stable, surgery is performed to repair the diaphragm and move any misplaced organs back where they belong. But the care doesn't stop there. Babies often need extra help like oxygen therapy or feeding tubes to grow and develop. Long term follow ups are needed also to ensure any issues with breathing, growth, or digestions are managed early. With all these efforts, many children with CDH can lead happy, active lives despite their challenging start.
Scientists believe that CDH is caused by a mix of genetic and environmental factors. Some babies have changes in certain genes like FOG2 or GATA4 that are important for diaphragm and lung development. Environmental factors such as smoking, alcohol use, or certain medications during pregnancy can increase the risk. Even a mother's overall health, like poor nutrition and diabetes, might play a role. While we can't prevent all cases, there are steps to lower the risk. Families with a history of CDH may benefit from genetic counseling to understand their chances. Pregnant women can focus on good health by eating a balanced diet, taking prenatal vitamins like folic acid, and avoiding harmful substances such as alcohol or tobacco. Ongoing research is helping us learn more about prevention. The earlier CDH is diagnosed, the better. Like Therese mentioned, doctors can detect CDH during pregnancy using ultrasounds and MRIs. If CDH is found, the baby can be delivered in a hospital with specialized care ready, including surgery and breathing support. After birth, babies with CDH need a team of experts, like surgeons and neonatal specialists, to help them breathe and repair the diaphragm. With early diagnosis and the right care, many babies survive and go on to thrive. Raising awareness about CDH can help parents understand the condition and advocate for care. It also connects families to support groups where they can find comfort and advice from others who've been through similar experiences. To conclude, CDH is a serious condition, but research is helping us understand its cause and find better treatments. By learning more, raising awareness, and supporting families, we can improve the lives of babies born with CDH and their loved ones.